All of the strains really operate in the same way. But if you test positive for the high-risk virus, then it means you are probably more susceptible, and therefore you might be more likely to retain it for longer. So if you've ever been sexually active, then you should remain within the cervical screening program. And with the HPV, if you take a test and it's normal, then you would be advised to take a further test in 2 years' time. Obviously, sexual activity increases your chance of contracting HPV. Well, so HPV, you can contract HPV through any skin-to-skin genital contact. It doesn't necessarily have to be penetrative. You can contract HPV. So it's possible to get genital warts, for example, without actually having sex. Although most cases of positive HPV we will see in people who are regularly sexually active, so oral sex, anal sex, vaginal sex. But in someone who's never had any sexual activity whatsoever, then there wouldn't be a need. So we wouldn't send a nun for an HPV test. But certainly in the environment I work in, people have a very, so I would have patients who wouldn't consider oral sex to be sex. Okay, so the definition can be slightly woolly amongst what people believe to be a risk and not a risk. So they've had oral sex, but then that they would never disclose that because they don't feel that that's relevant. When actually it's very relevant because you can carry HPV in your mouth or in the genital cavity. Not of having done the test, but obviously if you had a positive HPV and you were pregnant, then you would have to discuss that with your obstetrician, depending on which strains you had. They would probably want to have a look at your cervix. So, or if you had symptoms, other symptoms, so irregular bleeding or discharge. But there's no, you wouldn't do it if you were pregnant, but if you've just done it and you discovered you're pregnant, then there shouldn't be any adverse effects. Lots of people have smear tests and then they discover that they're pregnant. I wouldn't advocate you use this during pregnancy. You will normally have, if you're due a smear during your pregnancy, you'll normally have that discussion with your obstetrician because it's, yeah, because there are changes as well that would be related to pregnancy that would probably revert to normal once the hormones. And we generally, most smears aren't advised until 3 months after you've had a baby, is the usual school of thought. Yes. Well, yeah, because otherwise women wouldn't get it. There is a test for men. There is a test. Currently in the NHS, they may be doing it in some sexual health clinics, but in the private sector, you can screen for HPV any way you want, really. You can screen from the genitals, you can screen from the tail end, you can screen from the mouth, you can screen from wherever you want, and you can identify 20 groups of HPV, high and low risk. We have a population of men who, this is probably not a discussion for early morning, but who actually have anal smears because of sexual activity, and they will have smears done in a similar way to women having smears of the cervix. HPV causes 5 in every 100 cancers, full stop. So there are over 200 types of cancer, and HPV is responsible for 5 out of every 100 types of cancer that people have. And it's emerging as a really big player in the cancer table. But one that we can vaccinate against, so it's a win-win. It's always it's a really good omen if things are coming back okay. But it can be 10 to 20 years after HPV exposure that actually the damage becomes obvious, yeah. So very important to attend for regular screens, but the more normal screens you have, the more reassured you can be.
So in like 10 years' time, I can just have more right now then?
What we see... The peak incidence in terms of cervical cancer is in the under 35s. So the age group between 25 and 35, That's where we see a peak. And then we also see a peak much, much later on in life, because as you get older, you're more likely to get cancer. So you can have subtle changes on the cervix due to hormones. You can have abnormal cells that will revert to normal. So that's why...
Connected to the HPV, or would that be the 1% that's...
That wouldn't be connected to the HPV, but it makes it difficult to interpret. If you're looking at cells down a microscope, it makes it quite difficult to interpret them. When you do the cervical smear, then you get the cells, then a pathologist looks at them down the microscope. So we would never say early on, so people who have sexual activity very early on, we wouldn't advise them to have a cervical smear, because actually it tends to show up things that aren't really clinically significant in the long term. Same with pregnancy. And we were always taught to not do a smear until 3 months after you've given birth. Currently you can't. You can access it privately through private clinics. You can even access it now through high street pharmacies. And even if you tested positive and it said that you'd been exposed to strain 16 of the HPV virus, because the HPV vaccination protects you against 4 strains, it's still worthwhile to have the vaccine, because it will protect you against exposure if you get the other strains.
Say you had, unfortunately, 6 to the genital warts.
Yeah.
Would it still be worthwhile having?
Yeah. Yeah, because actually the most important thing that the vaccination protects against are 16 and 18, which are the 2 strains that cause cervical cancer.
To a pharmacy and then pay for vaccination now if I wanted to.
And I think the vaccination program will change completely as well. And you know, we'll start vaccinating boys and opening it up to more people. Yeah. Yeah, it is. I mean, I think it's a great thing that we now have this causes cancer. We now have a vaccine that will get rid of. Currently, it only covers strains 16 and 18, which will account for 70% of cancer in the UK in terms of the cervix. But the new vaccination that's coming, Gardasil 9, will give broader cover.
So it would be worth waiting for that.
Yeah, and I think that's imminent. I'd say that will be here next year. So every 3 years here, you have a cervical smear. You start having them at 25. In Australia, I think you start having them at 18. In the Netherlands, it's 30. Across Europe, it's 25. So in Ireland and France, and up until in my lifetime, so up until 10 years, about 8 years ago, up until then, there was no cervical screening program in Ireland. Depends on what stage cancer it is. So if you have stage 1 cancer, your chances can be as much as 99.9% of surviving. Most people survive it. If you have stage 4 cancer, then you're looking at something in the region of 20% or less. Late diagnosis is a disaster where cervical cancer is concerned. So early diagnosis is key, which is why screening is so important. So CIN is contained within, so cervical intraepithelial neoplasia, and then when it goes beyond the cervix, then it starts invading so it might, usually if it goes beyond the cervix, it will go into the womb, it will go into the ovaries, it will go into your lymph glands. And the reason they stage it is because they do different treatments at different stages. So radical surgery, or you might need chemotherapy, or you might need radiotherapy. So they go through various stages once you have established cancer. But yours is within. When it's CIN 1, 2, 3, it's within.
Okay, so it's
within. Yeah, within the. And the 1, 2, 3 is kind of, if you could think of it as a layering system, 1 is in the top layer, then 2 has gone to the top and the second layer, and then 3 has gone to the 1, 2, 3 layer. Do you know what I mean?